to support the Health Legislation Amendment Improving Choice and Transparency for Private Health Consumers Bill 2026. One of the things Australians are most proud of is our healthcare system. We value a system that ensures everyone can access the care that they need through Medicare, through bulk billing and through a network of high-quality public hospitals delivering world-class treatment. But Australia has many other aspects to our incredible Medicare system, and this bill deals with two of them that are of critical importance: the private health insurance part of the community of the healthcare system and our specialists. Private health insurance is a crucial part of our system and of our balance. It works alongside Medicare to give people greater choice, to relieve pressure on the public system and to ensure that we can sustain a mixed model of care into the future. When it is working well, it supports timely access to treatment, greater flexibility and choice for patients, and better outcomes across the whole system as a whole. But for that to remain true, Australians need to have confidence in it, confidence that it is transparent, that it offers real value, and that it is supporting, not undermining, the broader healthcare system. On specialists, I'm delighted that in Wentworth we have some of the best specialists and healthcare providers in the country. But increasingly, I do hear from constituents that while care is available from specialists, it's not always accessible because costs are unclear, unpredictable and sometimes unaffordable. In a cost of living crisis, this matters to people. It can be the difference between accessing care or choosing not to book that appointment. Or it can have a tangible impact on daily decisions about spending and family accounting. This really matters. While for some a referral to a specialist may be urgent, for others it may be preventative. If the price is prohibitive, this may discourage patients from accessing the preventative care, tests and treatment they may need. This can have significant impacts on their health months, years or decades down the line. And this is one of the core problems this bill seeks to address. Right now, a patient will often go to their GP, receive a referral to a particular specialist and simply assume that it is appropriate or the only option. But what they are not told, and often can't easily find out, is how that specialist's fees compare to others. Many patients feel uncomfortable raising costs with their GP, even where there is strong trust. They may hesitate to speak openly about their financial situation or worry that asking about fees could be questioning a referral to a high-quality specialist. Two specialists with similar qualifications and experience and expertise can charge very different fees. There are often valid reasons for that, but it's not fair that patients making decisions about their healthcare don't have access to that information. Healthcare is one of the most important decisions a person will make, and yet, unlike almost every other part of our economy, we do not equip consumers with the tools to compare price, understand value and make informed choices. We know the consequences of that. In 2024-25, around 8.6% of Australians, more than 800,000 people, delayed or missed specialist care because of cost. That is not just a statistic. That is people putting off essential care because they do not know how much it will cost them. This bill begins to change that. So now to what this bill does. Schedule 1 introduces a transparency by default model. It amends the Health Insurance Act and Private Health Insurance Act to allow the department to publish clear, comparable information on medical fees and expected out-of-pocket costs. Crucially, this information will no longer rely on voluntary participation. It will be drawn from existing databases, Medicare claims, hospital data and insurer billing data, and brought together to give consumers a clearer picture of the cost of their care. This means patients will be able to see in one place what different specialists charge for the same service, the likely out-of-pocket costs after Medicare and insurance, whether a doctor participates in gap cover arrangements, and where services are provided. It also enables publication of information about hospitals and insurers, including what policies cover, how gaps arrangements work, and how often patients face out-of-pocket costs. Importantly, this is done without publishing any patient information, so privacy is protected. I'm glad this process will be done without requiring specialists to manually provide this information, instead using existing data. However, it is important that we continue to hear feedback from specialists as this process evolves to ensure that there's a smooth transition and that the data that is collected is actually an accurate representation of what is being offered to the patients. This reform will breathe new life into the Medicare Cost Finder. We know that the current model hasn't worked. Despite a $24 million investment, only around 1 to 2% of specialists have opted in to share their fees. This bill fixes that by making transparency systemic, not optional. I'm also supportive of the member for Kooyong's amendments, one of which seeks to use future data drawn from Medicare to provide upfront information about quality indicators, such as complication rates, readmission and patient-reported outcomes, and information about whether procedures or specialists typically employ upfront or gap cover arrangements. However, I believe this framework should only be available for the Secretary to use when appropriate and alongside publication of relevant case complexity where relevant. This will ensure that it doesn't inadvertently discourage specialists from taking on more complex cases, which may carry higher readmission or complication rates, regardless of the quality of care provided. This provides further information to consumers to better understand pricing arrangements and transparency regarding differences in prices, as higher prices do not always indicate higher quality outcomes. I'm also supportive of an amendment from the member for Kooyong, which will ensure that the Minister must update published information as soon as practicable if they can become aware of greater than 10% reduction in the price of services over a 3-month period. Schedule 2 addresses another critical issue, the cost of private health insurance itself. Private health insurance covers more than 15 million Australians and represents a $30 billion industry, but has also become increasingly complex and in many cases more expensive. One of the key issues has been product phoenixing, where insurers close an existing product and reopen a near-identical one at a higher price, avoiding the usual premium approval process. This bill closes that loophole. It requires insurers to seek ministerial approval, not just for premium increases or on existing products, but also for new products and for changes that reduce coverage or value. It also formalises a premium approval process in legislation, introduces a clear application period and applies a public interest test to ensure the premium decisions are made with consumers in mind. I appreciate that this is a good solution to solve a very difficult problem. I appreciate that there will be a public interest test for premium approval for new applications made by insurers within an approved application period, and that there will be an allowance for the Minister to delegate approval decisions, but not refusal decisions. However, as is often the case when new regulatory requirements are introduced, I will be watching closely to ensure that this does not slow down insurers' ability to bring new products and benefits to the markets. Because we do not see currently from the government strong accountability when it comes to decision-making timelines, either from the government, from departments, from or government agencies or regulators, and that matters here. I do not have faith that we will see in these instances, despite best intention. That is why I am moving a second reader amendment in my name to address this, and I seek leave of the House to move the second reader. A second reader amendment in my name. Sorry, anything? Just okay, fine. And I want to really make the point that delays in approvals are not just administrative. They have real consequences. They can limit access to new or improved cover, reduce choice, and ultimately disadvantage patients. And so while I support stronger oversight, it must be matched with timely, efficient decision-making, because at the end of the day, when the system slows down, it is consumers who bear the costs. And I do want to talk more broadly, particularly about my second reader amendment, and in terms of government timeframes for making decisions, because this is an issue I see time and time again when I talk to members of my community, when I talk to businesses in my community. I see this when I talk to businesses trying to make large investment decisions, where they approach the ATO about saying, making sure that this investment decision is being covered in a particular way, and the ATO just doesn't get back to them, sometimes for 18 months, for 2 years. You can't run a business like that. I see this when people are applying for visas and where family members or businesses are trying to sponsor people to come to Australia, and the timeframes are, indicative of what the government would like to see, but actually they just aren't borne out by reality. That's not a fair way to deal with people. I see this in waiting times sometimes on things like Services Australia. I see this in home care packages where people are promised a home care package and then don't get delivered for a long period of time. I see this in an area of government which drives me crazy, which is around drones. I'm going to digress here because it's really important. Drones are a capability for the future, and I think if you look at what is going on in the wars overseas right now, we need to recognise that probably drones are one of the most important defence capabilities we have. But we have a system where approvals on things like of innovative drones is really slow in this country. I think that is not good enough. I think that Government, agencies, regulators are not accountable for the timeframes of their decisions. Government is a monopoly. Government agencies and regulators are monopoly providers of services. They do not hold themselves accountable to businesses or consumers who rely on those timely decisions, who often are afraid to push for more timely decisions because they're scared they're going to get a negative outcome. And so that is why this makes me nervous, to put everything back in the hands of the minister, because what is the commitment of the minister to make timely decisions? What is the commitment of the government to ensure that this doesn't just slow down new products being offered to Australian consumers who need them? To return to the sort of key part of the bill, I do support, however, the intention of the bill, which is that of practical reforms that will improve transparency, strengthen oversight and help restore confidence in the private health system. I just wish that this bill included something that committed the government to a time frame for it does its work. I think it is important that this oversight remains and that transparency remains. Again, I'm supportive of the member of Kooyong's amendment, which requires the minister to call a review after each financial year of applications for new product subgroups and changes made on premiums, to keep parliamentary oversight of harmful private insurance practices really front and centre. But, Speaker, we should also be clear. This is not the end of the reform task. Transparency is essential, but transparency alone does not guarantee affordability. We still need to address the underlying drivers of rising healthcare costs. We need to ensure that rebates, gap arrangements and incentives are aligned with high-quality, accessible care and investment in prevention. And we need to ensure that private health insurance is delivering real value to Australians. This bill lays some important foundations. It ensures that patients are no longer navigating the system in the dark and that they are equipped with more information they need to make informed decisions about their care. And that is a fundamental principle of a fair and effective healthcare system. So for those reasons, I commend this bill to the House.
Thank you. Is the amendment